Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series, which can be heard on VHHA.com, Apple Podcasts, Spotify, and wherever you get podcasts. We're a member of the Virginia Audio Collective and the Family Podcast Network on the radio each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, 107.7 FM, and 8:20 a.m. across Central Virginia, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send any questions, comments, or feedback to pcfpodcast@vhha.com. That's pcfpodcast@vhha.com. I'm Selena Lohr with VHHA, and today we're excited to be joined by Dr. Singh Sahni, Medical Director of the Neuroscience and Gamma Knife Center at Johnston-Willis Hospital. He joins us for a conversation about surgical procedures to treat brain tumors and brain disorders, including focused ultrasound and the recent milestone of 5,000 gamma knife procedures. With that, welcome to the program, Dr. Sahni. Thanks for being with us.
Well, thank you.
Dr. Sahni, let's start with a brief primer on neurology and brain tumors and brain disorders for the uninitiated. There are more than 120 types of brain tumors, lesions, and cysts. Some of these abnormal cell clusters are benign and others are cancerous and therefore harmful. Depending on the type of tumor, symptoms can range from headaches, impaired vision, loss of sensation of movement in the extremities, mental cloudiness and cognitive impairment, personality changes, and seizures. Hearing that, someone listening to this might wonder how to know when symptoms rise to the level of consulting a healthcare professional and how to avoid that by taking care of one's brain. So let's start there, Dr. Sahni. Can you address those two concepts?
Sure. I think a lot of people are scared as soon as they have a headache that they might have a brain tumor. And as we all know, that's not necessarily true. But at the same time, one can have a headache that sounds like a typical tension headache. And that might be the initial sign. But one has to pay attention to a lot more than that, such as dizziness, balance issues, visual issues, hearing problems, which kind of leads more towards the diagnosis of brain tumor. The most common brain tumor, of course, is in patients who already have a known cancer. Certainly like patients with breast cancer and lung cancer, we're always on the lookout to make sure they don't have a metastasis to the brain, because that is one of the most common tumors coming from another cancer. So usually it might get picked up without even any symptoms when the patient with cancer is being staged with different scans. So we should be on the lookout for that.
Do you wish you could focus on practicing medicine without all the distractions? Coveris is here to help. As a leader in medical professional liability insurance with more than 45 years' experience, Coveris provides insurance protection with data-driven predictive modeling to help you mitigate the risk of claims. By combining insurance protection with risk analytics services, you can reduce distractions and focus on improving clinical, operational, and financial outcomes. Coveris is reinventing what you should expect from your medical professional liability provider. Find out all Coveris can offer you at coveris.com. That's COVERYS.com. Insurance products issued by Medical Professional Mutual Insurance Company and its insurance subsidiaries, Boston, Massachusetts.
In addition to tumors, there are an array of brain disorders that can range from Alzheimer's and dementia to epilepsy, Parkinson's disease, stroke, and aphasia, which is a language comprehension disorder that recently led the actor Bruce Willis to announce his retirement. Some of these conditions are movement disorders, others are linked to cognitive decline. All of them are reminders of the power of the brain and nervous system over our bodies. The mind has long been a subject of much fascination and exploration. From your perspective, Dr. Sahni, what intrigues you about the power and function of the brain?
So I think it would be fair that I talk about some of the disorders that we are very actively treating currently here in this hospital, Johnston-Willis Hospital in Richmond. And one of them is, as you mentioned, movement disorder. Patients with Parkinson's disease, or even without Parkinson's disease, patients who have severe tremors of the extremities. Some of these patients are quite handicapped because they cannot even eat, drink, or for that matter, take care of themselves. These tremors can be very wild. We are now treating them with a very non-invasive technique. It's called focused ultrasound, as you mentioned earlier. Focused ultrasound is a treatment that we use for patients in the MRI machine. It does not involve any surgery, no incision, no cut, no stitches, and we use sound waves. And it is one of the most enthralling procedures with instant gratifications. Patients come in with these severe tremors to our center, And when we are done with their treatment, which takes about an hour and a half to 2, they leave without tremors. This technology, focused ultrasound, also has a lot of future potential of taking care of other brain disorders, but currently FDA has only approved it for these tremors in Parkinson's patients and essential tremor. So we really are very excited about this particular technique that we're using. The other technique, of course, as you mentioned earlier, is for brain tumors and also diseases called trigeminal neuralgia. It's exquisitely sharp facial pain. People will go to a dentist or an ENT doctor thinking they have tooth for extraction or pain, but they have a neurological problem where a nerve in the brain is being compressed. It's almost like electrical shock on the face. Patients used to even commit suicide before this treatment was available. Now we have medical management and we can take care of them. And it's not very well known, which is why I want to talk about it so people can really hear about it. Patients sometimes end up in the emergency room and physicians even don't recognize what the problem is. So unless and until you think about trigeminal neuralgia, you really cannot take care of it. And we take care of them with Gamma Knife, which we've been doing now for the last almost 18 years with Gamma Knife, and before that with other procedures. And really, Richmond JW Hospital has now become like a central place for patients from within this town, but also from out of state. And we've been very, very excited in providing this care.
Thank you for that explanation. As we mentioned a few minutes ago, and as you brought up, Dr. Sahni and his team recently completed their 5,000th Gamma Knife procedure. The arrival of this technology within the past 20 years has been a game changer for the treatment of brain tumors that once may have been fatal. Now, patients who undergo this non-invasive, computer-guided technique that narrowly focuses radiation on problem tumors can receive treatment and return home the same day. If you would, Dr. Sahni, tell us more about this procedure and how care advancements are changing the prognosis for brain tumor patients.
Yes, definitely. As a matter of fact, we are one of the few places, probably among the top in the country, that have reached that kind of a milestone of having treated 5,000 patients with the Gamma Knife. Gamma Knife is actually not a knife, so that's the first thing to clear. It is an exquisitely precise way of targeting brain tumors with radiation, but sparing the normal brain. Conventional radiation and other machines will treat brain tumors, but then they also spill over to the normal brain. But the Gamma Knife is precisely targeting. Most cancer is now becoming targeted treatment. Even with chemotherapy, immunotherapy, we try to target tumor. In the past, one of the problems was with most of the cancer treatments, not only would you kill the cancer cells, but you will also kill normal cells. With Gamma Knife, we can take care of the cancer and the other tumors in the brain without actually damaging the normal brain. What happens is on the day of the treatment, patient comes in here and we basically target the tumor with the MRI and with more than 200 beams of radiation coming from a very computerized navigated technique in this machine that is actually manufactured in Sweden, we treat those tumors. What it has changed is, I remember myself about 10 years ago, patients who have breast cancer, lung cancer, melanoma with brain metastasis used to be told they have 6 months to live. That is no longer true at all. With this treatment that we are doing now, as a matter of fact, it's very unusual that they will die of their brain tumor component because we can really control them and we can keep treating them as necessary when the oncologist is taking care of the rest of the body. Some of the patients may come over a period of 3-4 years and might have had 4 or 5 treatments, but the brain tumor can be stopped from further growth or progression. So it really has entirely changed the prognosis of patients with cancer and brain metastasis. And then similarly, some benign brain tumors in patients who are elderly and are too sick to undergo general anesthesia or an open operation, they can have Gamma Knife as an outpatient and go home without having to undergo a major invasive surgery. So definitely it has made a very big difference. And within my own lifetime, I used to operate on tumors called acoustic tumors. These are tumors that sit on the balance and hearing nerve. And I used to sit here about 14-15 hours in the operating room and operate on these patients. And they would be in the hospital 3, 4, 5 days and then rehab. Now the same tumor, at least 80% of them are being treated by me with Gamma Knife as an outpatient. They come in, they get it done, and they go home without a surgery of 10 hours, without an ICU stay. So it has really entirely revolutionized our field of medicine.
And Johnston-Willis was the first U.S. hospital to earn the Joint Commission Gold Seal of Approval for brain tumor care. You previously mentioned this, but in addition to the Gamma Knife technique, I gather that focused ultrasound is another promising non-invasive treatment. If you would, is there anything else that you'd like to tell us about focused ultrasound? And what's on the technical horizon for treatment of brain tumors and disorders?
So focused ultrasound, just like Gamma Knife, as I said, is a non-invasive or a minimally invasive technique which does not involve any incisions or any anesthesia, any cuts, nothing. This is one of the things that we are pioneering and trying to really establish our center at Johnston-Willis Hospital, where we are up in the non-invasive modalities of taking care of patients with neurological disorders. So with focused ultrasound, we bring them in our center and we get the MRI done on the same day. And there's a machine called the InsightTech. This is manufactured actually in Israel. And with the beams of high intensity focused ultrasound, we target a very precisely small, tiny part in the brain, in the thalamus. And that's the control center for tremors. People who have tremors, we ablate that area. We basically do the same thing that used to be done in the past by either putting a radio frequency or prior to that with electrodes being placed in the brain, which is invasive. It can help, but it is invasive, and this is non-invasive. The up-and-coming thing about focused ultrasound, which is not FDA approved yet, but there's a lot of research going on, is about brain tumors, where you can open up the barrier. Between blood and brain, there's a big barrier, like chemotherapy that can go for lung and liver. Unfortunately, does not always go up to the brain because there is a natural barrier between the blood and brain. There's a lot of study going on trying to open up that barrier with focused ultrasound so we can take care of those patients now, just like we do with the other kind of cancers. In addition, there's a lot of studies going on, especially in Europe, for treatments for Alzheimer's and other neuropathic diseases using focused ultrasound. That is very, very in the preliminary and primitive phases, but in Europe there is a lot of studies going on. So we hope once that is all established and if it gets FDA approved, we at Johnston-Willis would be up front in the lines with our experience to go ahead and take care of those patients when we're ready.
Awesome. And thank you so much again for being with us today. Before we go, we have a tradition on our podcast to ask each guest a pair of personal questions to give our audience a sense of who you are beyond the work you do. To keep things interesting, we have a list of 10 questions. So if you would, could you pick two numbers between 1 and 10? We'll ask you the corresponding questions.
7.
Sure. You could choose one superpower to have or any one skill to master. What would it be and why?
I like to be sitting on Mars and I could tour around Mars. I am very fascinated with life beyond our world, and I think there is life, and I wish I could explore that and find out in my lifetime that there is life there.
Awesome. I love that answer. And another number?
How about 7? I said 7 already. So maybe we go with 3.
3. What is the best piece of advice you have ever received, and why does it stick with you?
Just be humble and listen to people more than talk. And it works all the time.
I like that advice. So that brings us to the close of another episode of VHHA's Patients Come First podcast. If you like what you heard, please make sure to leave a 5-star review and subscribe so you know when new episodes are released. And we want to once again thank our guest, Dr. Singh Sahni, for joining us today. So thank you.
Thank you, Selena.